Assalamu alaikum bari wala assalamu alaikum kamo be konton yanen kadum kacha kono al konton bake ngal bismillah again kamun nan discussion ol tijam kamen sama nan jawat wo ati men yalon kay be den national issue lalla o kamala mo be konton no mo be dawda randing ka fal ko welcome to our political discussions, and today na bemen kachala wolo be dending na health sector la wala membe kerenge ning men be pol follow kan Gambia bifana ku dolel be kere min yalon ko I think they are very serious mamera fembe serious la membe tambila na jadi kende ya bunda ku membe kerenge jadi kende ya bunda dokulalu ko man kontan dokulalu sita protesta mengkira sit down protesting was sit down protesting masakunda inata itoliaje ko memu decision ot itol sementano je wolo nyenti ko dokulalu ke be suspend for watla or suspension of an be kono sita salary sodola wala kedan na health sector. So the government of the Gambia through the Ministry of Health, a press statement of Fontini Kaitandiko, the public health officers, many alonko ibe Gambia, many alonko isitale, iko ibe sit down strike lela. Masakunda ko itolia decision o make le Kaitandiko, womolu, itol yawul sindi le sign for carifula, o carifulo fana bekono imanta ka salary soda ila do kudlado. Which means ye wol sindile ita ko di la fokari fulo be kono katum itol ko wol man ta dok wal but say ko ni fon problème ni fon be nata nyame lafta ko wole diamu ka jibe fo masakunda itol ye decisional ta me alon ko e nyen naka wolta bang fondon ye kula ke be alon ka manke ketati bawo ni ajibe ning masakunda ila dokulalo sako dokulal men dokumarin kon na jati kende ya bunda ning ini wolbe nyin sifa kono wala union no ini wolbe nyin fracas sifa nyin kono sakunda member wala mu hakil tuwati kaje ko ikana decision ke me alonko wala be banku dingol torala dika option wol jibe me alonko wala be kala best option ti atay nyin do torala te fono fon torala problème ni na commencé ndula ala nga follow woto because ni problème commencé tala kabrin 2020 covid-19 not 2019 another 2019 na ending ma wala but na jele ko government ye kodole sodo kodo mi alon ko tata fo million jama Gambia kodo wo million jama nata nyaadi la parliament o dol approve dol be yewol sodo through the international donors but be nata mun kam that is to fight against covid-19 in the Gambia. Now in fighting against that covid-19 in the Gambia, the government of the Gambia needed the health workers ka je ko mun ko min yalon ko wolel be do ko woni kala ka fonte mol kan ka mol immunize ka mol sensitize covid-19 na min yalon ko fana yesa sa so do min yalon ko be handula that is the health department do kulal men fon yalon ko wolel fon be do ko nyim fon kono wolel ka fontin kata ka mol no kan ka mol sensitize be fon kala covid-19 na nyamen iba moneke la pour ka je ko coronavirus akana spread mol kono men be mol test la many along many COVID-19 sort of isolation centers to be created. Many along they are taking care of all those people. Yinal munna jadi kende adu kulalti. So ninja jadi kende adu kulamolu masakunda ni million billion jama men besoto ya be samana meneka mapuru ka je ko COVID-19 ba kala nyagira. Ni many along kay be do ko wala alawanso nyana kadila wolel kono. Alawanso nyana kadila ila wolel be kono. But kabrin 2020 aliyaje lako diamul commencé ta Dr. Amadou Samate Fongotara Parliament kaitandi ko monko ala health sector corruption bakata wala biye molka planol ke kaje ko ye kodota masakunda bloko no nyin covid-19 phone nyin ako beren ko ye name sol sambe na pour ye name sol dina min yalon ko wala nyanaka alawanso nyi soto ning ayata nun ko tonya mo membe do ko wala filo nin kono men nin coronavirus la do sasa la be do ko wala nim mo kemelom ye listo media tara fu mo keme woro wala se bajala ko nyim mo keme woro nyi bebe ko do tara la hatre mantra masakunda do ko wala nto yo ko do so be sinya fula sawa ay wo for parliament or mo be upload because fen no me alon ko ay toro refe ka je ko mun ko Masakunda la ko do katinya ay lo bari men yalon ko wolle fon be do ko la sain wala alawanso makadi wala kabrin 2020 for now alawanso makadi la 2020 yenin sit down strike nim propose le Masakunda na te kai promise comme ko ibe fundile kanane ini ye ko nyin diam ila ko do nyin abedile la this was 2020 kabrin 2020 for 2022 nyilla alawanso amandila and COVID-19 ko do men na Gambia ngalon na ko mo million jama ballo muti but say minister ataka mo nekam fa Dr. Lamin Samate member sabula ateba flako abenyun lel sindi la volcana ta do ko wala nate nyul sindi wol manta do ko wala we Gambia dingol le tora bang fo we nyul lel fana dama tora bang ngey le jibe yalo nim problem mo na de ka problem mo jibe le ba sol flamen amanke semboti kugele ngam fo nyini ka wala Dr. Ahmed Samate ateka allowance so men dama is too much professional allowance no that is more than 100,000 different from his salary ala professional allowance coming for Kumungo. I don't know whether it is the qualified or the highly qualified allowance ala medical allowance manna Dr. Samadela allowance or hanikili wole siata nyin dokula bela joti nyin dokula kilingo kilina joti atel allowance or killing and Dr. Samate atenana mam for allowance or kabrini COVID-19 kumaseta kabrin COVID-19 commencé ta anana mam fo allowance hani kilena baw allowance ba bulu kana tara fo tan nim fen allowance tan anim fen aka wala so bo allowance wol damma ni ka fu nyoka wasiyata Gambia ko do wili keme fulotile allowance damma wona la jo manna wona la padie mon manna ka menta bantani tanina wol manna aninga ka ko do mesoro president balo bulu kono because of ala cyber fancy involving himself in the politics so nyilbe manna so ning atemoka for allowance sola ndenga mira atememu health department la ministry atelefon nyan nakalo ala doku lalle ka je ko mongo wala allowance so ku kanati koma bodi gamam fa ko mongo jalo singo be lorin fonto ankam tan dawta ko sila nyil allowance so manna nyil bete ko to doku wala kabrin 2020 mantre la allowance so soraka mun dalila basabula woliatol engage into dialogue because kabrin 2020 long so these people were patient enough to involve the government in dialogues but dialogue ni mo work no kabrin 2020 up to now so I need desire to finally to go into sit down strike any sensitive government you can menkala by looking at the sensitive nature of the job and the crucial roles that these health officials are playing in the Gambia or in any country for that matter. Government should have bound down. They do everything humanly possible. Then ya for health workers all basically 371 health workers. 371 health workers. You will base in this work now. What the whole movement in the health department already is dilapidating, is crumbling. Is crumbling. So the limited human power, the minister of the Yemen will let them assist la. So I need will base in this work. What do you expect the Gambian citizens, the poor Gambian citizens, will not faith Bekalamuneti side? The poor Gambian citizens will not faith Bekalamuneti side. We have a very insensitive government and a very selfish minister of health, Dr. Samate. So it ain't based in design. Sasa told menka kurang menka sasa menka saloptano say wala faith bekala muneti so Dr. Samade man corruption no bayno afangola Masakunda kono because ade fongo dabe corruption no kono le ala ministry ade corruption no kono nyaadile ade mo ka fo ala ni allowance be la kew allowance wo yo allowance Dr. Samade ka base to la kew ka mo ka fo ko hani fenna so ning Dr. Samade ade mo ka fo ni allowance la but I expect the other lower employees in the health department should endure for free for 3 years. That is selfishness. That is lack of empathy from the side of Dr. Samate. And the only thing Dr. Samate has funded to release that stupid press statement, these 371 health workers will be suspended for 2 years without salary, for 2 months without salary. Without salaries. Nimbang kubeke in dunia kono. Many along ko sulata experts ole, sulata dokula la jatikende abundato. Gambia mu banku follow let many along ko wolle sulata jatikende dokula la katam dunia banku bela kew. Ñinam to ñati. Because mang joran soto.
Joramul many along ko men fong laka do ko ke bake wol man soto. So these people many along ko wolel mu do ko la na njati kende abunda to. Wol ke la improvisation wala ke kaje ko mungo ka cool fa men se sa to la ninjanka to ke mako do man ninge fam. Men se wol mako do man ninge fam. 371 health workers. Ni commencé à Cabrin 2020, mais vidéo clinker la jang, vidéo à Cabrin 2020, and I believe that any sensitive government, any concerning government would have taken a drastic action against this injustice me alonka yalangi health dogula nika. And nula concerns should have been heard. Cabrin 2020, ngajele ko doctorol ye doctorol protestal no. Doctorol protestal no wofuna manki fenti. A manki fenti fonying alawanso me alon kay muka dila aliyo albe wakalam ta janne doctorol protestale I protesta fo mo ni doctorol lafta ka kuyano but then mul ma be understand no membe be kere no for bring COVID-19 fananar. So now look at the health sector membe kere nge Dr. Samate being the minister is receiving all his allowances all the bogus allowances aka mesoto as huge as they are wala sabu Dr. Samate complain. But many bata ko to do ko la the junior health officers wol manya na kela alawan sosoto and the man right finance to puruka diam the man right finance to puruka ila balambaya ni tandi the man right finance to puruka anything ke me alongo is not going to be liked by the minister ali nyulla kuriya jale Dr. Samate ka ni alawan so me besoto ni aka fu nyoka ngasira fo dalasi wili kame fula curriculum kono de woni ngala karifa joman clear woni ngala ni padiyamol man clear and all the other privileges me yalon kaki soro but men ba ko do ko la men yalon ko la salary amam fancy wala alawanso wol manya naka wasoro andi manya naka diamu fana andi manya naka kuke me yalon ko ate Dr. Samate ate man lafi wallet Cabrin 2020 ni ayata nun ko ni munyi ne concerneti ye Gambia di wala health na jati kende bunda ye wole bunya Cabrin 2020, 2021, 2022, how many millions of Gambian dollars was spent on that useless campaign that Dr. Samate was part and parcel of? Adam Barola presidential campaign. How many bogus expenditure you meluke just to show the Gambian people the white elephant projects in the health sector? The projects that are never being fulfilled, many along they are never realistic to the Gambian people, never beneficiary to the Gambian people. Why not? You could utilize, they put it into a better use. Any health department, on paid allowances, many along big kabri wati. You will do demanding pre bajalako, do course attendant. Kanabula yun hakoda, you can able hakoda, prove going a kind of the board after them to be. Because the thing has already escalated. It will go in baile for 2 months. You would suspend for 2 months, it's a salary deal. Let's say. And I think this is what should happen. Na jatikanda do kula belom kabrin doctorol lambang for no so lambang for all the other public health officers many along ke mal suspend albele nyam nakana nan aliela nyokan kew nyenuma la department olet nin kata la department to be alman la almonyo lukang the same injustice will be la alfanang andung atakuno lage. So that is why the health department al kafunyo kan one umbrella and fight against this injustice now and forever. The doctors, the nurses, the public health officials, albela mukew, albela nyokamba, nying doctoral, walanto nying health officials, the public health officials, you men suspend nante, alle kambang aliye fasa, alaje komonko, over your dead body that nyula suspension on yimbekala, atu later dokola. So you all go and sit home. Doctor Obe kew kanava nosto, albe say unless you swakana, almonyo yenyi men lekang. Ning almallo nyofi alenyo makoy sama the same thing nebekala atol fana na andung ate kuno lagi altina akambe sotola alla department alla union not na sembe sotola no Gambia banko kan men diata masa kundae ibolo kala la kuten wala ge. Let me tell you that so the health department, this is your opportunity kajeko injustice and in corruption and in the selective treatment member kikang alla health department pour kala minister put into account kala minister ning alia nya yelendi kaitan dala ko ndol lafta men na wala be kala kuriya memben kan aidam albele be lala nyokan kabrin doctoral fo no sol for public health officials boda felol ka fo albela nyokan alia ko mo ko aidam bi aidam for good Albesis Wokono, Alcanata Dokola, Cabrin Doctor Lambang, for no soul Lambang, for the other public health officials, many along Adamanke Jinkoro. Remember, these are the people, many along need better at the same school. You were all the same batchmates and everything. So, need injustice like that injustice should not be supported by you people. It should never in any way be supported by you. Because Allah department, like future. The future of your department will be at stake. Jam. It will be a progress. I'll be a future prosperity. Will be, colarinjan sign the B. Will be larinjan the B. Will be larinjan the B. So, at all nyan nakamenke, albela nyokang doctoral public health officials and in the noso albe, Allah nyokang aliastan in solidarity with these 371 employees. In the health sector, Kajeko, you all stand and speak with one voice. Ning alman woke. Allah demands, Allah rights will never be heard and will never be considered by this government. You are led or headed by a corrupt minister, a minister who do not care about you all. He is from a very poor background like all of us. But nibota nyimpo background sifatu ndengam itelen naka bunya soto fuarolye itelen naka respect soto fuarolye itelen naka bunya soto fuarolye no expect control meni alon ko botan family fuarol kono ntolen nyen naka fuare ya nyen na bata nyen long ntolen nyen naka nyola bata long. But look at Dr. Samate, a very corrupt minister atakala ni alawanso besoto, but yet he do not care whether the people working under him have received their allowances or not. They've cried, they have shouted, they've went to the media, they have wrote, news headlines about this. They have protested on the camera, which is all over in the social media since 2020, to make sure that the demands that they put to the government were met before Kuyimbe escalated to this point. But it was never been considered, it was never been valued. Because the health workers, many along those are the junior workers, many along will be feeling to go and have direct contact with the COVID-19 patients, to go and sensitize the people. Those were the animals to them. Well, Mankumaya, at the Dr. Samate, all what he care, at another PAM secretary and the other high echelons will kill allowance also fat salaries. That's all what they care. So the other people, you should be like they are puppets. Whatever they say must be obeyed. But Allah department, the future, the progress of your department is at stake here. The nurses, the doctors, the public health officials. At all, the best thing that you could do now is to see ways how you are going to make sure that the minister's psychophancy in degrading your department, in degrading your co-employees, through way down, I don't be forever. When you're not done forever. Kabrin Dr. Samade Tata no parliament. Any expose on you get corruption on the department of me. Molbe worse again. You know that Europhobia, what don't have because I attended the government saying I have no saying and saying he was good to go. So that Europhobia was ended at that point. At that point. And now he became 100% engaged himself in corruption and politics. And look at the fat lies during the campaign. Yawo ambulance men besa mbabrika maloptano to kaita ni brika mangola and the west coast that nimbe ma life angola alkazefa adam paro ko yin ambulance bedila wo ambulance la hani kilinga tije bi ni mo nyina ka meni alo ke dogo la health sector in brikama ikafonye ko ambulance tije where have you been to? According to what we heard, you ambulance be mutal ye be luase in Senegal, ni Senegal mo sakundale nyomoy, ye funa wala ye samana Gambia, ye taxol ke bala those plastic tax many alongo ni pare da bila mo ke sabara ye bondi bala. Yo plastic tax sol nyinke bala kabrin kam kabrin kat defa wata mirada mbalo winda ye Senegal mo sakundale ambulance be se ndima. This is the kind of deceptive minister that we have. I don't like health department should have known this better. And that is why Allah you sit down protest and the so-called suspension of the 371 health workers. albele nyen nakala nyokam aliya je ko mongo aliya la right you defend. This is your right. It's not just the right of the 371 employees. This is the right of the health workers, the employees in the health department. This is your right and your everlasting rights. Ning aliya bula folla ni rights on ni muta yen dol tan violate ay watin. Truly speaking, Allah health department will have a long way to go. So this is the opportunity for health department and messenger. This is not political. We are just trying to create or to support a system that will benefit entire nation forever, for good. This is what we are fighting for. This is not political. UDP government, I personally will stand here and say the same thing. This is not political. You cannot be using people. You cannot be using the knowledge of people, and yet you're treating them like animals. You must give them their rights. You must give them the rights that they deserve. So health department olamu ning al lafta ali la moyala ning al malafi al kadi la moy al moñol ning al lafta ali bule da may ñi fight ñi ke faway sama atol men fana yalla ko bi al mantara kono tomorrow similar situation o bal mala whereby ñi dotel lu lan wala because abatara yalla mutala ya tala ñobala sal mantara kanklen. So it's better albelo albeka kanklen jali kelote be fenkele la fondit la ñam video kilingam albe a video jibe ñi mo kabrin 2020 la tamo me yalla ko no sol fana bela protest ñina ñi mo kabrin wala 2020. So albaje la ko ñi masakunda manke ñi masakunda mammo care. These people don't care us. But mbebe siri mo man son maka ñinu fasa mo man son maka fasa masakunda man fenka ye pour ka je ko be ñi kala ñame. So I just gonna make a video kala jam pour al be a jibe.
Hello Gambians, home and abroad. Your brothers and sisters are working without pay.
It's 3 months and counting without pay.
We have bills to pay. Pay us.
We are frontliners without pay. No pay, no work.
This was Kabrin 2020 lanyen. Kabrin 2020 anu nyim video fana kabra fundita social media. Masafunda nata ye kuma dimal fu nyune ko mba jola le ala do mandoma ye timeline o dila. Go timeline on nata a pastor. These people started protesting again. These people were ready to dialogue with the government. They were not selfish because you understand the call. It is their brothers and sisters, many along Gambia. It will be South. These people were not selfish. They were not selfish. They were selfish. In 2020, when this video was made, the things would have been escalated more than where it is today. But he was selfish. He had all the privileges, he had all the opportunities and time that the government needed for their allowances to be settled. They gave that to the government. So who is going to blame these health workers? You cannot blame them. We all know how our survival in the Gambia is. You work and you depend entirely on your monthly salaries and your allowances if you are privileged one. So the minister allowance will be settled. The professional allowance, the expertise allowance, the ministry allowance, and all those nonsense allowances that do not make up at all. Ateka will be received without any complaint plus his salary. Ala dokulal, wal mukela allowance will receive for sangi saba sangi nani. Iko wal kanadiam. Iko wal kanadiam. They must talk and they have to talk. They have to demand the allowances that they were privileged to. They've worked for it, remember. You learn more frontliners, the many along in coronavirus victims or the patients in direct contact risking their life, risking the lives of their families. Because once you have coronavirus, ila potential more base is very, very, very high. So you need our life you risk everything. Yet still, imanson na kay Joe, imanson na kay alawansol dila. Kabrin 2019, 2021, 2022, almost coming to 2023 now. Yan yung mol bulagi yebula ko mo ko mo beamolet. Doctor Samada bingine kay kang Gambia. Andung imalafin na health department will ye diamo ako nyen. Why wouldn't they talk? So Gambia lim belang adeng yolang nimol men yalong ko ye suspend. Let us defend them. Health department nak kabring a doctor role lambang, a doctor role nyilmal do ku nyolat. No solo nyil medicine de suko nante bi imankuke nyilmal do ku nyolat. Samay be disem ti nek latul fanan na ning al mal data nyokam aliye nyo muta. Aliye tanda law minister kurung lako ntolbe mu kilimolati na nyanto nyanna ka sotola nyimala nyanto lati doku yemen doku ke balu wala ita doku wala modo ke balu wala ike nyaka sitela yak wodiam for sangi saba hansa gaman solve no yemen sort of weapons. This is a very professional way that every serious institution, this is the first step ikamenge nibe bagenina. Sit down, strike. If the government is conscious enough and they know the repercussion, of course they know. Come on, you see that. The health department, Gambia de Fuarolo, Wallet Babara, Science from Bemunacono, Messamalacono, Sasalbina Sialale, Susula Sasa, and all the other waterborne and airborne infections will be in Gambia, and you can see the Sakoman Samacono. Imagine Jumalebe will take care. These are the public health officials. These are the people that comes with the policy documents, and they try to go down to the provinces across the country, come all sensitize on what they should do. It will base in the 371 public health officials member Gambia back. You will base in this eye. How do you expect the poor Gambian people to survive? Masakundama wo miro fongoso, Masakundama wo balafa fongoso fu arolye. But yalde will mention the nanteng. Ibe fundla kan nakoteke in 2-3 months time. Kafale ko alkatwa fa koteke. And Dr. Samada is going to be part of that team. Pur kafale ko alkatwa fa koteke. And they will come up with those white elephant projects many alongo imanna faso to Gambia. Pour kala katol ñi ko rekal bulokon andu alba di lela dol bel kono alba di lela ñi be mo karamuti demandi Gambia ñi be mo karamuti demandi dol banku di men ka katel fay ñi be mo karamuti demandi jandimbe kacha banna binde mo fala wululon de kerim sawali baba la commando sawali, we wish you a happy birthday alama simayani jarikenda bakela alama nga asifa celebrate jama. So wala mu kacha da tinte membe mbulo kono Gambia alenga lo nga kata nga je ko ngalo nyoy wati nimma bo ke drong mem fango tora la bakel be line o yalla ni membe ko kala no WhatsApp isa ko WhatsApp yalla take info on this issue ni health department la issue ni me alon ka be kerinje yela point on info. So WhatsApp line o flenga yela jam. I think I just have to pin it. Nimme yalon ko ye fenso de la faka monfo. You can call WhatsApp. It's a call ke non on the WhatsApp. Yela point on info. Ibajala ko salong membe keringe. And fana yalon kalbe health department, please now the program o jive kan you can still call. Those working at the health department, you can still call. Also call kan aliena membal to aliafo nye ngamoy. That is the only way we can work. Ning wo manke rekate ben because masakunda men block is indeed pathetic. We just have to keep talking. Nim man tenten dia mola rekate ben. Nim man tenten dia mola te ben. Betenten dia mola le purunga tano. Nim won ten rekate ben. But nim balafa water bakela, you know, balafa water bakela. Every department kuyabije. But you know serious bakela because nimu jati kendere. This is a matter of life and death. Na banko jati kende abunda ite wol sende ndol man jati kende dogula jama sodo because mu kejo so jati kende dogula alfani right sodo jama bi je ka bot lay da banko dol mote blame la of course. So but ite mo ko wol jo bi wol yen decision o make and the meta nyin ko nyin ka je ko mun ko ni masakunda e nyomoy sanji saba koma ni masakunda be nyomoy la nyaadi la ya ko be ka da pour ni masakunda e diam masakunda e nyaka sila say ñu fana man option soto fo ka je ko mon ko yesi ko mon ko te do ko kale be silale yow option da mala soto fende je semen keno yow option soto wole wasi okay masakunda ina nan ko yewol besindi fo karifula and wo karifulo be kono wolte jo soto la ibe gambe di wol tora kamba fo be do kula da mala tora yes asake ne bo do kula tora kan but ibe gambe di wol tora kan fo arolu sasa tolu ita fongo ye kurano mude bulbala ko ibe menkela ibe melu tankala ibe mel la jati ke da dilela ibe mel la nyanto dilela ye kurano tanka ka wollal ye kurano muta ye wollal betray ye kurano ni ne fair Amadou Samate imira ye kurano le fair with your zoo president ale kurano le fair so you have to treat your workers with respect. You don't get slave state. These are academically qualified people. Many of them, they went to the School of Public Health and got their qualifications. So you know manke benti. aliye banko kan alkaliye banko kan but ñu le banko kan atolti because atol ka salary mesoro hana allowance kilum wala ka si ñu la kalifa jobe but yet still ñu le ke fo risk ibe dok woka ñu le yi fo risk ibe dok woka kana fundi ka fu ñeko mon ko ñu mam ko ñu mam banko kan ñu mam banko kan jala wonyo nene ko moto kere wonyo nene ko moto kere. So it's very sad that Nyensi Fabeke kan Gambia and this is meant for no health nkolie kabel doctor kundalom for no kundalom for public health kundalom alkana son bi alkana son sama yalla ngi mol men sindi alkafuma albe alla nyanto aliyakele ning almal la nyanto kele fo ñi yeñi batteria mel lada bi ñi ndol kan al sonda wo batteria ñi masakunda ye sawo no so deje alla health department belom Allah health department belong yalon doctor rolo aliye sital no aliye protest kenu last year or somewhere around year before last al sital no yagele bonata na bondi but ning ndol tata fo albe sital ya nyaka sila fo yenyi mela ndol ko tata masa nguna bajal ko ni ake groupe la ni groupe do te fukala because almanyo kanu almanyo muta almal la nyanto fongolong as a department and as a union almal la nyanto fongolong. So I do not think, and I do not want to believe that in the health department, doctors and the nurses and in the other public health officials, I'll be selfish enough to abandon your cohorts, to abandon your fellow employees, your friends, your colleagues, to abandon them at this time, on their right for that matter. So, you know, this is meant for Kuanyento, be program on your phone than the janitor. Ngajela skeno mon mang fanga bake so ala baraka bake alma tilo to diala ala baraka bake assalamu alaikum warahmatullahi taala wabarakatuh.